Hello ladies and gentlemen, and welcome back for more Let's Play Trauma Center Second Opinion. In the last episode we did 4-2 race, or 4-1 Hope Under Attack, 4-2 Race for the Cure, and 4-3 Nothing to Do But Wait. In this episode we're going to be doing 4-4 Stepping Up. Derek, you're going to operate on Dr. Kasal. Huh? But I thought you were scheduled for that procedure. I asked him to switch with you, Derek. Why? Dr. Clark's is an experienced surgeon. I'm just a... I know that you told my brother you couldn't operate on me. I'd like to know why not. Well, what if I did something wrong? I mean, you'd... Are you worried that I won't make it? Of course not. You're going to... Then make it happen. It looks like I forgot to teach you a very important lesson. You've developed your skills, but something's still holding you back. Sometimes a doctor needs to ignore his personal relationships. Huh? A friendship should have no bearing on your surgical abilities. Once someone is in the operating room, they're your patient and nothing more. You're their doctor, so you save them. That's all there is to it. But I'm still human. This is especially important because you have the healing touch. I won't let you end up like Robert. Dr. Hoffman? I'll explain it when the time comes, but for now, you just need to focus, Dr. Stiles. I know you can do this. Think of it as a trial. The final test before you can call yourself a doctor and really mean it. Dr. Kasal. Well, doctor, can I be cured? Yes, I anticipate a full recovery after the procedure. Who's going to be operating? I will. You don't sound very confident. You can trust me. You're in good hands, Mr. Kasal. That's the spirit, Derek. Remember, I believe in you. Yes, sir. Alright, we have Dr. Greg Kasal, 70.9 inches, 145.3 pounds. Tetarty bodies confirm that the patient's liver. Inject the newly designed serum to eliminate the guilt. Okay, Dr. Stiles, I'll be explaining the details of this operation. As you know, Tetarty is a very dangerous strain of guilt. They function in groups of 3 and produce a harmful pathogen. In other words, the Tetarty itself acts as one poisonous mass. But if we administer our antibody serum, the guilt should die. Victor just completed that serum, so I'm sure you're aware, So that there's just one objective in this operation. Kill the guilt cells in his liver by injecting the correct serums. As we discussed, the Tetarty will weaken once you inject the serum. There's a different serum for each one, so pay attention to colors. Remember, the Tetarty cells are synchronized with each other. You have a limited window of time to inject all 3 cells. You have to be accurate and fast. Of course, every surgeon should be. Dr. Kasal is a fine surgeon. As you trained under him, and now you have to save his life. Do your best, Derek. I plan on it. Good luck. Now let's begin. Okay, Dr. Kasal, we're beginning the operation. Dr. Kasal, this is your final test before you can be proud to call yourself a doctor. I want him to believe in you the same way that I do. Alright, so cut him open. And this is why I said, talked about the colors there. Tetarty is formed toxic diverticula there on the liver. When they reach maximum size, those sacs release poison. So we got to inject the serum of each color. So inject the purple into the purple, the yellow into the yellow, and the Moron. Green into the green. Yes, I just called myself a moron. And just cut it out like you do any old tumor. Boom. Just remove them. And of course, like regular tumors, place the membrane over them and antibiotic gel them. Alright. All the reticula have been removed. The guilt should reveal itself in order to reconstruct them. We're supposed to inject the serum into all three of them, correct? Alright, so I do mess up a little bit here. I don't know how, but somehow I wind up messing up. I don't know why I used gel on them. But anyway, you just need to find the right color. That was the wrong color. So I know how I messed that one up because I'm a moron. Yay! So anyway, you have to inject them, and I missed, so they're going to redo themselves. So, and I believe you want to do that as fast as you can because I believe those tumors can get bigger and actually destroy what do you call it? Destroy themselves and hurt the patient's vitals. So you don't want that to happen. So. And so I just wait for them to come back. And there you go. There's one. There's two. And there's not three. Yay! I messed up again. I'm a moron. Hooray. Anyway. I know it's not funny to try to kill the patient, but or I'm not trying to, but just pay attention and don't mess up and be an idiot like me. Obviously. I think this is where I finally start getting it right and stop messing up. So just inject them as fast as you can. Oh nope, it's not. I'm wrong. But try to do it as fast as you can. That way you can do whatever you have to do with them. So, and I messed that one up too. I don't know how. I swear to God, I was getting that. I was nailing that Tatarty guilt. I don't know why I kept saying I wasn't hitting him, but anyway, there you go. And I believe you only have to do that 3 times, so do it again. There we go. And I believe you only have to do it one more time. Right? Just doing the little green gel that puts the vitals up to just to make sure that it doesn't go down too far, because I get really nervous playing this game. So especially on the harder, the more difficult guilt, which we will get to a more difficult guilt later on also. So this guilt is pretty easy once you know what you're doing. So all 3 Tatarty had disappeared. We had negative chiral reaction. Dr. Kasal will be proud. Let's finish up here. Guess you finally repaid him for everything he taught you at Hope. Yep, anyway. Go ahead and close him up. And there we go. And good job. We just saved our mentor, Dr. Kasal. You really improved, Dr. Styles. That rookie surgeon who trembled before Kiriaki is gone. I think Dr. Kasal will be proud to call you his doctor. Alright. So there we go. And I forget what we get on this one. I think A rank. Alright. I can understand that one. We did make a whole bunch of mistakes, so is he alright? I removed all traces of the guilt tissue. Now we just have to wait and hope that serum takes care of the toxin. I can try telling Dr. Kasal he needs rest, but knowing him, he'll want to return to Hope Hospital immediately. He needs to recover first. Guilt is just about the only thing that could bring Dr. Kasal down. I'm sure he'll be back to normal in no time. Dr. Myers? It looks like they're a little understaffed. Maybe you could help with Dr. Kasal for a bit. Me? Yes, of course. I'll be glad to. Come with me then. Okay, so now we're going to continue on, and we are going to start 4-5 Foreboding Clues. Angeles Bay City Hall. And that's why a substantial medical grant would... Everyone's... Mr. Secretary, what's wrong? It's my chest. Mr. Secretary? We need help here. Somebody call an ambulance. But who will take record of my sins for our modern age? Is this some kind of prank? Wait, could this be a... Chief! What is it? It's Richard Anderson! Then this... Empty Thursday. As each death is sacrificed, man finishes his dwelling in hell. But who will take record of my sins of our modern age? Of the sins, sorry. Does this mean... What is the Secretary's condition? We haven't gotten the test results back yet, but it's most likely guilt. How could this happen? How did they get close enough to infect Secretary Anderson? We need to formulate a plan with Victor. Call in our entire staff. I hate interrupting his day off, but we need Derek here as well. Yes, sir. So, that's it. So next time we will do 4-6, the first step. So until then, thanks for watching everybody, and have a great day.